Yesterday, we hit two records. The most vaccinations administered in New Zealand in a single day, 56,843. So far, 72% of New Zealanders aged 40 plus are either booked or have been vaccinated with at least one dose. This is great progress. Over 150,000 vaccination bookings were made yesterday too, which is fantastic. And yesterday, we saw the most COVID tests processed in a single day, 41,464. The fact that we have achieved both these results on the same day is extraordinary and is exactly what we need to do, both to get on top of this outbreak, but also to prepare us for the future. But despite reaching record numbers, we do need to keep going. We need to test to ensure we can get an accurate picture of the perimeter of the virus. And we should also be using this time to increase our vaccination rates.
Today, I can report that there are 21 new positive cases of COVID-19 in the community. That brings our total number of confirmed cases associated with the current Auckland community outbreak to 51. All cases have been or are being transferred safely to managed isolation facilities using strict infection prevention and control procedures. Of the 21 new cases, 18 are in Auckland and 3 are in Wellington, one of which we reported yesterday. Investigations into the source of these cases continues. 21 cases of the 51 are now confirmed as part of the Auckland cluster, with the remaining investigations still underway to confirm the specific linkage, but initial assessment shows that in the vast majority of cases there is a link. On locations of interest, we are working around the clock to get further details of the movements of cases. We have been hearing concerns about the time it takes to get some locations of interest published. Whilst it does take time to gather that information, we are working as fast as we can to get that information out and to put the list of locations up on the Ministry's website as soon as it becomes available. Also, use of the COVID app allows push notifications to go straight to people who have been at those locations of interest. So that's another way in which we can quickly identify those contacts. I do want to reiterate that if you were at a location of interest at the specified times, please self-isolate and call Healthline on 0800 358 5453 for advice on testing.
As you can see, our number of cases have grown again, but given the large number of locations of interest and what we know about Delta, this isn't surprising. We have always said cases will rise before they fall. And based on the experience of overseas countries, we do expect cases to continue to rise through to next week before they start coming away. And it's always good for us to share what those expectations might be before we start reporting cases in the coming days. So we do expect them to increase. But there are actions you can take to make sure we don't create new cases or spread the virus in lockdown. One of the things we have learnt from New South Wales is that the virus can keep spreading during lockdown from people going to work or people breaking the rules of a lockdown and meeting up with other people, then passing on the virus. This is one of the key reasons their cases keep going up and their lockdown continues to be extended. And a devastating 825 cases have been reported in New South Wales this morning. No one wants an extended lockdown and no one wants to see that rate of transmission. So the number one thing everyone can do right now is reduce down your contacts and ensure you stick to your bubble. I especially ask that anyone who is a worker at an essential service, make sure that you do not go to work until you get a negative result, and employers have advised you of this too. If you are in those groups of people we've asked to be tested. This morning, I asked our public health team how our compliance was looking, and it was really heartening to hear that the people they are contact tracing are at home. That is exactly what we need. We just need to keep going, because that means eventually our locations of interest will eventually start to decline as we contact trace people who have been at home during their period of infectiousness. On locations of interest, I do have an update in addition to what has been shared by Dr. McElnay this morning. You'll recall that some days ago we talked about genome sequencing helping us to narrow the likely source of COVID to an individual who arrived in New Zealand on the 7th of August. We said at that time, though, that we're continuing to still keep some of our options open. That was because we didn't have a complete sequence, but it was enough to give us roughly 90% confidence in our theory. That sequence was then rerun, and we received the results yesterday. The results of that give us even greater confidence in the match. On that basis, a decision is being made to remove locations of interest that predate the 7th of August. We ask that everyone from those locations still, of course, comply with level 4 restrictions. So you still need to stay home, but you no longer need to report for additional testing. Of course, that decision has been made only recently, so it will, of course, still need to be updated on the locations of interest website. This is an example of how the science can help us narrow the public health measures that are needed in an outbreak. It was absolutely right, though, in a Delta environment for our public health team to be cautious in their approach till we had evidence to the contrary. Just a couple of quick pieces of information before we wrap today. We know isolation can impact on the ability of people to access food. If you're sick or cannot leave home to buy food, you can ask family, whānau, friends or neighbours to make a contactless drop-off of groceries to you. If you are delivering supplies to someone, remember to stay 2 metres apart and wear a face covering. Ideally, though, just drop things on people's doorstep and leave. You can also use your supermarket's click and collect service and ask a local friend, family member or neighbour to drop off the groceries for you. As I said, compliance and reducing contact is critical to stopping the virus spreading. Overall, though, compliance has been outstanding. We're seeing a similar level of reductions in traffic and movements as the last time that we were in level 4. Since alert level 4 came into place, 17 people have been charged with a total of 20 offences nationwide. Of the 20 charges filed, 11 are for failing to comply with the Covid-19 order, 7 for failure to comply with direction, prohibition and restriction, and 2 for Health Act breaches. In the same period, we've had 53 formal warnings issued. Police have also issued 70 infringements nationwide, including 61 to people who failed to remain at home and 5 for persons who failed to wear a face covering. And just a reminder, you do need to wear face coverings when you enter into an essential service like a supermarket. Overall, though, those numbers are really low, so thank you to everyone for sticking to the plan that we know works. Even if we know we have a plan that works, I know the uncertainty of these periods of time in lockdown are really tough and does have a real impact on mental health. Please do not forget to reach out to friends, family and whānau who may be struggling. A phone call, a video chat, a message all really helps. Local GPs are still working at alert level 4 and can provide advice on how to get help to support your mental well-being during this alert level, including phone and video consultations. You can also call 1737 for free-to-talk services, and that's with a trained counsellor. That's 1737. There is more information about how to access the range of mental health support services on the covid19.govt.nz website. Some of the online services there are absolutely fantastic. So please don't hesitate to look, and I encourage you to share that information with others.